I'm Jesse Burks. I'm originally from Benton, Arkansas. I went to school in Iowa, Des Moines, Iowa, and then I did my residency in Indianapolis, and then I did my fellowship in Graz, Austria. Back in 1999, we moved back to Arkansas, and we've been here ever since. Well, I'm usually in clinic 4 days a week. So clinic is mostly, new patients or post-op patients. As far as new patients, it could be anything from ankle arthritis to bunion to hammer toe. I see tons of heel pain, which I've had too. So I do that 4 days a week. And then usually I'm in surgery every Friday, some other days if I need extra time. When I'm at Arkansas Surgical Hospital, it tends to be a little bigger surgery. I do a fair amount of ankle replacements. That's kind of a great procedure to do because most people that need an ankle replacement, they're at a point where it affects everything in their life. Just getting up, moving around, going to the kitchen, getting something to eat. When it starts affecting their daily lives and you replace the ankle, even though it's a big surgery to get over, you can't help but make them better because you automatically take out that bone grinding on bone. So that's something, a little unique. I enjoy being around people. That's one of the things, I know some people just love to be in the OR. I like to be in the OR, but I like clinic too. I mean, it's nice to kind of break it up. I love the people at ASH. I love that it's efficient, it's organized, it's always clean, it's bright. I mean, even though it's been here 20 years, you'd never know it's 20 years old, because I've been to a lot of places, you're like, oof, it's 20 years old. I like, getting to see different people and meet different personalities. I think one of the things is that at least a lot of the stuff that I do, you can at least make it significantly better pretty quick. It's not like you're like, okay, you're gonna, in most cases, make it 10% better and that's all you're ever gonna get. Most people are pretty happy that they're like, hey, this may not be perfect, but it's significantly better than it was. So that's probably the biggest thing that I like about it. What I would like patients to know about me is that the days to me are way gone of the surgeon going, here's what we're gonna do. What I want patients to know is that they have a say in what we do. If they come see me, it's not, I'm just gonna be like, yes, we gotta do this. In most cases, you don't gotta do this. In most cases, you have choices.